This is the second part of the utilization of dental services lecture. And in this particular video, we're going to talk about factors affecting utilization as well as some barriers that also impact utilization rates. So some factors that affect utilization, of course, socio-demographic factors. So some of the same groups of people that aren't utilizing dental services are the same groups of people that actually have higher epidemiology numbers of oral health diseases. So we'll go over that a little bit more in detail. But we're also going to talk about delivery system factors. So how the dental system is set up, how does that impact an individual in terms of utilizing dental services. And then we're going to finish that up by talking about individual characteristics and how that impacts utilization as well. So let's first start off with socio-demographic factors. So the first demographic that I want to talk about is age here. So what we know is that the very, very young and our very, very, very old people tend to be low utilizers of dental services. Our middle-aged adults tend to be higher utilizers. So it's almost like an upside down U. No, scratch that. It's like a U shape. With the very, very young, so like we have 1-year-old, 2-year-olds, 3-year-olds, a lot of times they're not going to see the dentist until they're getting closer to elementary school age. A lot of general dentists won't see kids until they're like 3 or 4. Pediatric dentists will see kids very early on, and some general dentists will as well. But the old kind of thought process was that, kiddos could come in around 3 or 4 or 5 and then they would be fine. And we're still kind of seeing those trends today. So the very, very young kiddos are not going to the dentist at the greatest rates that we would like to see. Our very, very old people are also low utilizers. That could be because they're edentulous. It could be because they're having mobility problems. They can't come to the dental office. Maybe they live in a nursing home, something like that. Our middle-aged adults are high utilizers, and you can see that in this graph here. The graph below, this is the BRFSS data from the CDC website. You can see that young adults 18 to 24 tend to be pretty good utilizers. They're probably still on their parents' insurance, so they're probably still able to go. We see that drop off in the next age range, though. So people that are 25 to 34 are the least likely of the adults to be seeking dental services overall. So that could be because maybe they're kicked off their parents' insurance, they're starting their careers, and maybe they just haven't gained dental insurance yet. And then, of course, the highest group here would be the 55 to 64-year-olds. We will see a little bit of a change with this with an increase of the dentate elderly. So the elderly, the very old elderly are keeping their teeth a little bit longer than previous years and previous generations. So we'll see a little bit more of a flattening of that U-shaped curve than before. This is the exact opposite of medical care, though. Think about who is utilizing medical care. Kiddos, when they're really young, they're going to the pediatrician a ton because they just don't have an immune system yet, really. So they're catching colds and viruses and all that left and right. And then they're also going in for their preventive services and well visits. And then our very, very old are the people that are also going and seeking medical care simply because that they're probably managing a lot of chronic diseases at that point. In terms of gender, we do see a little bit of a gender difference in terms of who utilizes dental services, and we know that more females go and they go more often to the dentist. So, statistics show that the females had a visit within the past year, and they actually had more visits per year. And this is held true over time. No one really understands or has figured out why this is the case, but it's always been the case that females have utilized dental services at a greater rate than males. And you can see the same trend is holds up for Kentucky as well. So more Kentucky females are going to the dentist compared to males. In terms of race and ethnicity, we know that a larger portion of whites compared to non-whites are utilizing dental services. So people that are racial or ethnic minorities are not utilizing dental services at the rate of whites. And services also differ here. So not only are they not utilizing dental services as much as whites, but the services differ. So whites tend to get more preventive care, whereas non-whites get more emergency care and more extractions overall. And again, this is a graph from the CDC BRFSS data. And you can see that whites are in the blue at the very bottom, and 69% of the white population had reported going to the dentist within the past year. And you can see the other racial and ethnic categories in the breakdown percentages there. Generally, this is related to socioeconomic status, but some studies even show that there is a difference when they control for education and income as well, so that there's a true race and ethnicity difference. In terms of income, we know that people that are wealthier tend to utilize dental services more. So, and you can see that here on the graph from the CDC, that it almost looks like a stair step there, where the bottom row is less than $15,000 in income, and we're seeing probably about a little less than 45% of that population going to the dentist, compared to probably about 78% of people that are making over $50,000. What we do know is that if cost was completely removed as a barrier, let's say that we had free dental care in the United States, we would still see that these people that are in the higher income brackets would still seek care more often. So the solution may not just be to have free programs or free oral health promotion programs, but we really have to get in there and change the value and educate the lower socioeconomic statuses, so that they can adopt more of that middle class culture in which a dental care is a part of. In terms of education, education is the strongest predictor of utilization of dental services, hands down. So if you're asked on boards what factor most impacts utilization rates, it's education. If education is not an option in the multiple choice question, this runner-up would be socioeconomic status. And the reason that socioeconomic status is the runner-up is that SES has a component of education in it along with income. So they kind of combine those two variables when they're talking about socioeconomic status. So what we know is that people that obtain higher educational degrees tend to go to the dentist a lot more often. And you can see here in 2016, the difference is pretty stark. People that did not get a high school education or high school graduate were about 45% went to the dentist within the past year. But people that had graduated college was close to 80% was going to the dentist in the past year. The types of services also differ within the educational level. So people that have higher educational attainment tend to get more of those preventive services, whereas people with lower educational attainment are more emergency based or extractions. Where you live also impacts utilization rates. If you looked at the nation as a whole, if you looked at different geographic regions, we would know that people that lived in the Midwest actually had the highest percentage of visits within the past year. That actually kind of shocked me because I would have guessed the Northeast, simply because of the whole income aspect of where higher per capita income would be. But actually, when you look at the statistics, it's the Midwest. It's followed by the Northeast, and then the third geographic region would be the West Coast, and then the South actually had the lowest percent of people visiting the dentist. If you look at it more on an intimate level, if you're looking at it as a city, we know that people that live in the suburbs actually have the highest percent of utilization rates, followed by people that live in the city, and then people that live in rural areas actually have the lowest percent of utilization. This kind of makes sense because people that live in rural areas or in the South, in general, they have lower educational attainment levels. They tend to have lower incomes. And then they also have the most unfavorable dentist to population ratios. So think about that map of Kentucky in that second lecture where we had 0 or 1 dentist in an entire county in extreme western Kentucky and extreme eastern Kentucky. So that was the first factor of utilization. So let's talk about the second factor of utilization, which is the delivery system. The first thing that falls under that is a dental home. So people that report that they have a dental home or a regular source of care, they're more likely to continue to utilize dental services. So it's almost like once they become a patient, they're more likely to keep coming back. People that report that they don't have a dental home, they're least likely to come on a regular basis. And if you're looking at demographic variables when you're comparing who has a dental home and who doesn't, people that are younger, especially younger adults, are more likely to report that they have a dental home or that regular source of care compared to older people. Insurance is one of the delivery system factors that greatly impacts utilization. What we know is that insurance obviously decreases the cost barriers of the individual to obtain dental care. So especially if it's an employer that is giving you dental insurance and you don't have to pay for it out of pocket. So insurance actually increases the proportion of people going to the dentist. But what we do know is that people that tend to be those low utilizers, so people that have low income, that are less educated, are racial and ethnic minorities, and all those demographic variables that we just touched on, those low utilizers, once they get insurance, they'll come to the dentist to get their perceived needs taken care of. But once their perceived needs are taken care of, they don't continue to keep coming back on a regular basis. So they don't continue that pattern of high utilization. What we do know is those high utilizers, so those people that have more income, that are more educated, um, that are whites, so our high utilizers tend to stay high utilizers. Even with insurance coverage, our low income groups remain low utilizers. Like I said, they may come in and get their perceived needs taken care of, but once that's completed, then they drop off. People that have voluntary plans actually come to the dentist a lot more than when your employer gives you dental insurance. So you're paying out of pocket for your dental insurance. So a lot of times, if you hit somebody in the wallet, they're actually going to utilize those services as opposed to, let's say, your employer gives you insurance as part of your benefit package. You may think that there's no skin off your nose for not going to the dentist and seeking those services because you're not investing into it. Your employer is. So people that actually pay and invest money into their healthcare, into their insurance, actually utilizes it. And then insurance definitely influences the type of services that patients get and the types of treatment that they get based on the coverage of their plan. So sometimes insurance companies can dictate the need of the treatment plan. So for instance, you have a patient that comes in and they have a toothache and their molar is really, really bothering them. When you look at the insurance plan, and you look at the patient and you do your assessment, you really feel like that patient could benefit from endo treatment. So when you look at the insurance coverage, the insurance plan covers hypothetically endo at 50%. So endo costs approximately about $850. That was a couple of years ago. It could have gone up a little bit. So if the insurance plans covers endo at 50%, and the cost is approximately $850, that patient is paying $425 out of pocket, especially if they haven't met their deductible that year. Not only do you have to worry about the cost of endo, but whenever you're doing endo on a molar or premolar, typically, you have to have a crown that covers it because you have to like build that tooth back up. So yeah, a lot of insurance plans will pay like 50% of the cost of a crown. So let's do a conservative estimate of a crown being about $1,000. Some places charge way more than that for a crown. But if your insurance plan covers 50% of your crown, then you're paying $500 out of pocket. So your total out-of-pocket payment would be $925 for endo treatment on one tooth and a crown on one tooth. However, when you look a little bit more, your insurance plan covers extractions at 80%. And if you look at the cost of extractions, a couple of years ago, it was about $200. So your out-of-pocket payment would be $40. 80% of $200 is $40. So a patient really has to weigh, do I have that extra discretionary income of $925 to save my tooth, or do I need to pay bills? Do I need to, put food on my table and those type of things? And I just pay $40 and I get an extraction and I get out of pain. So that's kind of what our patients are having to deal with, is kind of those cost-benefit analyses. And you have to throw in the money into that and how much they're going to have to pay out of pocket. The third factor of utilization is individual characteristics. So Whether a person has teeth or not really impacts whether they're coming to the dentist. So people that have teeth that are dentate are four times more likely to come to the dentist. And you can see the statistics here. The dentate individuals, 65% of that population is coming to the dentist, compared to 14% of people that are edentulous. If you ask them, was their last dental visit more than 5 years ago, those numbers flip. So edentulous patients are not coming to the dentist, and they're not coming to the dentist for years and years and years. And this is closely related to perceived need. They really feel like they don't have a need to go to the dentist because they don't have any teeth. What they don't realize is that they're actually getting oral cancer exams. They're also getting exams in terms of how their dentures are fitting and those type of things. When an edentulous patient comes to the dentist, it's mainly because they have a problem with their denture. The exception is the dental school. The dental school has done a really nice job of trying to get those patients that are edentulous, our denture patients, to come into our clinic to get their dentures clean, and so that we can actually do a visual assessment of them. Other people who really feel like they're in great health, great general health, or very good general health, they're more likely to utilize dental services. People that really classify themselves as being in fair or poor systemic health tend to not use dental services. I don't know if this is because they have so many other systemic problems going on that dental care really kind of takes a back seat to all these other more pressing problems, or if it's just a whole conundrum of my entire body's in fair health or poor health, and there's a lack of value system there. I don't know the research on that. Another individual characteristic, like we talked about, perceived need and value system. That is a major explanation as to why people are not coming to the dentist, and they may just see the dentist as being there for preventing pain, as opposed to really kind of doing the overall preventive services of hygiene and keeping those oral diseases away. And then finally, we have orientation of parents. So these are your caretakers. Generally, in the past, it's been moms, but we're seeing more and more dads kind of being the caretakers and within their families. And really, early socialization of kiddos to oral health is a very, very good thing. So if they see you kind of coming in and doing your preventive services at the dental office, then they're going to carry that on in their own life. If they see a parent come in and they're white knuckled in your chair and they talk about how fearful they are and for the dentist, then that's really going to kind of socialize that child into thinking that the dentist or the dental hygienist is a very scary person. So, you know, parents really do influence children and set them up for either a lifetime of accessing good preventive dental services and not being fearful, or it could go the other way around. So those are the three factors of utilization. So let's talk about some barriers. So there are three different barriers that I really want to highlight. The first one is structural. So this is the physical part. So a patient may not be able to get to that location where the dental office is, or maybe the dental office has hours that are the same hours that a patient works, and the patient can't get off work to go to the dentist. Maybe the dental office itself is not handicapped accessible, and the patient can't actually access and go into the dental office because they can't, they have some type of handicap. and that's an impediment. It could be that, like what we talked about in the second lecture, in those very rural areas, there may not be any dentist within that county. So a patient would have to go to the next county over or two counties over to get to the dental office. So it could be, having to drive 45 minutes or an hour to get to the dental office. That could be another barrier there. The second type of barrier is probably what most people think of whenever they're thinking of why people are not utilizing dental services, and that's financial. They can't afford out-of-pocket payments, or they can't afford the insurance, dental insurance. And then finally, we have personal and cultural, which includes the dental anxiety, the dental fear. It includes those lower dental values overall within a community. The Surgeon General actually collected data and wanted to know why people were not going to the dentist within the past year. And you can see the overwhelming percentage of reason would be no dental problem. So people were citing no dental problem as the reason as to why they weren't going to the dentist in the past year. The runner-up was no teeth. They were a dentalist. So those two, the very top two reasons, are correlated with no perceived need. That's close to 60% of people. 60% of people that have cited those two specific reasons as to not go to the dentist. And it's all about perceived need there. We need to educate these patients regarding the importance of routine care as opposed to just coming to the dental office when they have a dental problem. Cost was a factor. That was the third reason cited. And then you can see some other reasons was that they were fearful, or they had a access care problem, or it wasn't important to them. So people that were most likely to report that they did not have a dental problem as the reason why they didn't go to the dental office in the past year, we see that the younger population actually reported that at greater rates than older population. And then we also saw African Americans report that reason more so than whites. In terms of reporting no teeth, it should make sense that older populations tend to reported no teeth as the reason for them not going to the dental office, and whites actually reported that more so than African Americans. The 18 to 34-year-old age group was the category that was most likely to report cost of care. So when you looked at who was citing cost of care, it was our 18 to 34-year-olds. And that makes sense because that population is just starting their adult life. They're starting their careers, and they have the least discretionary income overall. So they're maybe caring for a child or starting a family. They're purchasing a house. They're purchasing cars. Maybe they are paying for their education, or they're paying off student loans. So all of that kind of takes more priority, I guess, over dental care, unless you have a really high dental value system. So in summary, the people who need care are not those people who are utilizing services. So the profile of a chronic non-utilizer of dental services tend to be a minority male who has low educational attainment, who has lower income, who certainly doesn't have dental insurance, and if you want to add in geographic location, they live in rural areas and in the South. The profile of the most frequent user of dental services tends to be a white female, college educated, suburbanite with a higher income bracket who enjoys good overall health and has dental insurance. So those are two vastly different profiles of people that utilize versus people that don't utilize dental services. So, exit ticket, go to www.socrative.com and the room name is CDH1 Lecture 8.